Hello, pharmacists and friends. Today is May 3rd, 2023. Welcome to the Regimen, where public health pharmacists, pharmacy students, and our guests discuss the latest public health issues. Listen to find out how pharmacists and pharmacy students like me can improve population health, health equity, and patient care through advocacy and education. My name is Brindley Rosepars, and I am a final year student at the University of Rhode Island, working with the Rhode Island Department of Health alongside my professor, Dr. Bratberg.
And I'm Jeff Bratberg. I'm a clinical professor of pharmacy practice and clinical research at the College of Pharmacy and the Academic Collaborations Officer at the Rhode Island Department of Health. As a reminder to our listeners, the opinions expressed in this podcast by the hosts and guests do not represent the opinions of the United States government, the Rhode Island Department of Health, nor the University of Rhode Island.
Awesome. Thanks for the introduction, Dr. Bratberg. So we are up for a very timely discussion today. For those of you that don't know, May is actually Hepatitis Awareness Month. And so on the podcast today, we are going to be talking about all things hepatitis, global elimination plans, also some harm reduction strategies that are really closely tied into these elimination plans. We are joined by a wonderful guest today, Dr. Adrienne Simmons, who I will let Dr. Bratberg introduce for today.
Yes, it's my pleasure. I finally got to hang out with Dr. Simmons at the American Pharmacists Association and presented with her on decriminalization. Maybe if we have time, we'll talk about that. Or we're just going to have her back at a less busy month. But we're going to talk about hepatitis today. And again, perfect guest, perfect timing. So Dr. Simmons is the Director of Programs for the National Viral Hepatitis Roundtable, which is a program of the Hepatitis Education Project that's fighting to eliminate viral hepatitis in the United States. After graduating with her PharmD from Virginia Commonwealth University, Dr. Simmons completed both a PGY1 and PGY2 residency in Health System Pharmacy Administration. Thanks for joining us today, Dr. Simmons, and please feel free to introduce yourself to our listeners and tell us a little bit about yourself and your background.
Awesome. Thanks so much for having me. I'm excited to be here and to kick off Hepatitis Awareness Month in this way. Thanks for the lovely introduction. I don't have much to add to that. Clearly, I'm a pharmacist by training, but as you'll learn throughout this interview, I'm an advocate at heart. So a lot of the work that I've done is in the policy and advocacy space, which is a little bit of a unique role for pharmacists. And so I would be glad to delve into how I landed in this role at some point. But just a couple of quick facts about me. I'm located in Washington, D.C., moved here about 3 years ago, right after my residency program wrapped up at the University of North Carolina. I'm originally from a really small town in southwestern Virginia, one of those places where there are more cows than there are people. So DC is a big city for me. And yeah, I really launched my career in a health policy role right after wrapping up my residency program at the first few months of the pandemic. So I finished residency in June of 2020. And have been in this role as director of programs ever since. So I'm glad to be talking with you about all things hepatitis today, especially during Hepatitis Awareness Month.
And we are so happy to have you on and get your opinion, especially with all of your experience in healthcare policy as well. And so just to give our listeners a little bit of background on what we'll be talking about today. So viral hepatitis is an emerging public health issue that definitely deserves a high level of attention, with agencies such as the World Health Organization endorsing global strategies with goals to eliminate hepatitis by 2030. It's clear that this issue should definitely be given some more attention in order to prevent infections, complications, and deaths. And particularly, we know that some of these infections can be spread through sharing contaminated needles, syringes, or other means used to inject drugs that those that use it. And so this is where public health really does have an opportunity to step in, particularly with harm reduction efforts and policy change advocacy to prevent these new infections and also some related disparities and inequalities in that population. And so to get started with our questions for today, Dr. Simmons, I would first love for you to tell us a little bit about more of the work that you do in your role for the National Viral Hepatitis Roundtable and how you originally got started in that role after residency.
Absolutely. I always love talking about this because, again, it's a unique role for pharmacists, and I am hoping to recruit more pharmacists to roles like mine. So a little bit about the organization that I work for. Jeff mentioned in his introduction that my organization is a program of the Hepatitis Education Project. So let's start there. The Hepatitis Education Project is a community-based organization that's located in Seattle, Washington. We're a small organization of about 20 people. primarily people who don't have formal healthcare training, but we are providing a variety of healthcare services to underserved communities, primarily people experiencing homelessness and people who use drugs. And so my colleagues in the Seattle office are providing services like hepatitis A and B vaccination, hepatitis B and C testing. We have a low barrier buprenorphine clinic that we partner with an MOUD program that's local in Seattle. We have a certain services program. We do a ton of outreach and education, both in homeless encampments and in jails and prisons around the state. And so I am part of our national policy and advocacy team. And so the name of our team is the National Viral Hepatitis Roundtable. We are effectively a national coalition of patients, clinicians, community-based organizations, and public health partners, like people who work at health departments, people who work at the CDC, anyone who has an interest in eliminating viral hepatitis as a public health threat. And so we really take all comers. I will say that I am the only pharmacist in my organization. We have a couple of nurses in our Seattle office, but the majority of folks that work there don't have formal healthcare training. And so we train people to provide these community-based services, really similar to community health workers, which is a hot topic, I think, in the pharmacy community. And so I work remotely on our policy and advocacy team. We're a small team of about 4 people, small but mighty. And so a lot of the work that I do requires engaging with policymakers, both on the state and federal level, around a variety of issues related to viral hepatitis. About a third of the work that I do focuses on hepatitis C treatment access advocacy and state Medicaid programs. And so, when I was looking into roles after residency, I knew that I wanted something that was more public health focused. I wanted something that had some sort of policy and advocacy role. And ultimately, the job description for this role was not looking for a pharmacist. They just wanted someone who had a public health background, ideally someone who had some experience in policy, but they certainly didn't list pharmacist as someone that they were looking for. And so when I interviewed, it was apparent to me that all of the skills that I had developed, both as a pharmacist, but also as someone who had gone through leadership training and residency, were skills that were very transferable to an organization like this. And so the most pharmacy-centric part of my job is this hepatitis C treatment access work, right? So in a nutshell, the people who are making decisions about which patients can access hepatitis C treatment, hep C treatment is very expensive, and so it often requires a prioritization. The people who are making those decisions are pharmacists that work for Medicaid programs. And so a lot of my work is spent in engaging with those pharmacists about how to improve their policies and how to ensure that they're not discriminating against specific communities of patients, like people who have a substance use disorder. And so that's the most, and perhaps one of the only pharmacy-centric aspects of my job. I certainly engage around some issues related to immunizations and just broader public health efforts. But the treatment access piece is definitely one where my pharmacy skill set was readily able to be applied. The other kind of 2/3 of my job is a hodgepodge of activities. No 2 days are the same. I do spend a good amount of time in meetings. I do a lot of stakeholder engagement because we're a national coalition. And so that requires engaging with folks that are in the coalition. But I also have a lot of project-based work. And so for me, it's been a really great opportunity to get an understanding of what our public health ecosystem is in the United States. And so I'm often engaging with health departments who are really the backbone, right, of our public health infrastructure, as well as clinicians that work in health systems and clinics all over the country, whether that's a community health center or a traditional academic medical center. And then I engage with patients too, right? And so unfortunately, patients that I engage with, when they find their way to my organization, it's because our healthcare system has failed them in some way, shape, or form, right? So they're usually reaching out to us with a challenge or with a barrier. And so it's my role to help whomever reaches out to us, whether it's a patient, a clinician, or a health department, really help improve access to viral hepatitis care. And that covers the whole spectrum of care, right? From prevention and things like vaccinations, as well as harm reduction programs, to diagnosis and testing, so making sure that we're being compliant with the guidelines around identifying new cases, and then all the way through treatment and care, right, and helping ensure that people have access to treatment. So a lot of my time is spent engaging with folks, hearing what barriers they're facing, and then elevating those issues to the people that are ultimately making decisions about how to address these issues. I am super fortunate to have landed in a role that for me really marries all of my interests, right? I get to put my clinical hat on some days, I get to put my policy and advocacy hat on most days, and then I also have some responsibilities around general nonprofit management, right? So things like budgeting and HR and fundraising are also components of my job. So a variety of activities, a small component of it is pharmacy, but the large majority of it is public health, and really an opportunity, I think, for us to highlight how pharmacists can contribute to advancing public health in a unique way.
And I would say that we have just for our listeners, and sort of the purpose of this podcast is to elevate the essential roles of pharmacists in public health and in advocacy, and that they're really the same thing. And that it's great to hear that you're doing these unusual things and you want to recruit people, but that's the whole purpose of starting off with this, is to say advocacy is part of everything we do. Bryn here has testified twice and is going to do it again tomorrow.
Yeah, that's awesome.
So she gets to go. No, it's a small state, so you go down. It's not, I think we're
right down the street from my apartment.
Yeah, we're a little bit from,
go to the State House.
Yeah,
the State House in Rhode Island is close to most things, but regardless, I think that there's ways that pharmacists need to get engaged. So speaking of marrying public health and pharmacists, just speak a little bit about I think, are you still the coordinator of the APHA Public Health Special Interest Group?
Yeah, I just wrapped up my term as coordinator of the Public Health SIG within the last month or so. And so, timely question. I spent the last year coordinating this special interest group within the American Pharmacists Association. So the way, for those of you who aren't familiar, the way that the American Pharmacists Association runs is that there are a variety of committees and groups that volunteer leaders can be a part of outside of their day-to-day practice, right? And so I ultimately was elected as coordinator of the Public Health SIG. There are, I believe, somewhere close to 20, I think, special interest groups, right, that range from specific disease areas like diabetes and immunizations to broader topics like public health or even precepting. So you can find your interest within the association and then get involved in moving the profession forward in that niche area. And so for me, I found my home in the public health SIG, and so it's been a really awesome opportunity to meet so many pharmacists across the country who are engaged in a variety of public health roles, both formally and informally, right? I think when people hear, pharmacists and public health mentioned in the same sentence, it takes some time to connect the two sometimes, right? I think that connection time has been shortened by the COVID-19 pandemic. Obviously, people now are, really recognize pharmacists as some of the frontline providers for things like immunizations and testing. But before the pandemic, that connection was harder to make for some people. And so the role of the Public Health SIG was to really highlight the role of a pharmacist in public health efforts, to increase awareness about that, and to have a home for people that are involved in a variety of different activities as it relates to public health. So if that's of interest to any of the listeners, I would encourage you to join the SIG. It's very easy. You just go into your pharmacist.com profile and sign up for it, and I'd be happy to get you plugged in with a work group. But some of the activities that the group did last year was in helping set the public health track programming at the APHA annual meeting. There were, for the first time ever, more than 20 public health related sessions at the meeting. Everything from naloxone to things like immunizations and infectious diseases. And so lots and lots of awesome programming, a lot of which those ideas started with the Public Health SIG. We also always have some sort of policy component. So last year we led the adoption of a policy about pharmacy shortage areas, also known as pharmacy deserts. And so again, a broader public health and healthcare access issue. that the SIG was able to make an impact on. So there are so many, we're a relatively new SIG. The advantage of that is that we can kind of make it what we want. So if there's someone listening that would like to get more involved in APHA and in public health, I would encourage you to reach out and consider joining the SIG. There are plenty of opportunities to make an impact.
Thank you so much for that, Dr. Simmons. It really is incredible how dynamic all of the different roles that you've had in your career already, and especially being able, like you said, to marry pharmacy and public health in all of these efforts. And so I'd love to kind of ask you a question more related towards the advocacy portion of your career. And so with your experience in advocacy, what policy changes do you currently think would be most impactful in improving care and increasing awareness around viral hepatitis and all of your work?
Oh my goodness, there's so many. So I will try to condense them down into what I think most people agree to be the most important ones. The first one is funding, right? So people, when we think about policy change, it usually is connected to funding in some way, shape, or form, right? And so in the case of viral hepatitis, let's maybe first start with some quick background on how our public health infrastructure is funded. So when you think about being able to go to your local health department and ask for a vaccine or to get tested for a sexually transmitted infection, the way that health department is receiving funding is typically from their state or from the federal government. And if they're receiving funding from the federal government, that funding is likely coming from the CDC. And so ultimately, the person that decides, the group that decides how much money the CDC gets, and then ultimately how much money our local and state health departments get, is Congress, right? And so my job as an advocate is to go to Congress and say, okay, this is the amount of funding that we need in order to address this public health issue. And so in the case of viral hepatitis, we have been advocating for increased funding for viral hepatitis programs for a long, long time. This is an area that is severely underfunded. And so to give you an idea, for the last 5 or so years, viral hepatitis at the CDC has been funded at about $40 million a year. Now keep in mind that not all of that money stays with the CDC. $40 million sounds like a lot, right? But ultimately, what happens is that the CDC keeps a portion of that money to conduct activities like data collection. That's ultimately the way that we know what the burden of disease is for any given area, is that the federal government in some way, shape, or form will collect and collate and analyze that data, right? So a portion of that money is kept to conduct activities like surveillance, or to conduct awareness campaigns across the country. You know, Hepatitis Awareness Month, for example, CDC has a campaign for that. But the majority of that money is actually distributed to state and local health departments for them to provide services like vaccination, testing, and other services to the community. Obviously, this is a really important part of our safety net, particularly for people who are uninsured and people who live in states where Medicaid expansion may not be available. And so hepatitis has been getting about $40 million for the last 5 years, in comparison to HIV, as an example, that gets about $800 million per year. Viral hepatitis gets a very, very small amount of funding. And so as a result, we have very limited services that are offered. We're able to test very few people. We have a large number of people who are unvaccinated for hepatitis A and hepatitis B. This funding doesn't ultimately fund treatment. Treatment is funded through people's insurance companies, right? But any sort of preventive care efforts or diagnostic efforts, a lot of those programs are funded through the CDC and then through your local health department. So funding is a huge issue for us. And until we address the funding, we will continue to have very limited services, and as a result, will not be on a path to eliminate viral hepatitis by 2030, which is the goal that the World Health Organization has set for all countries to eliminate these public health crises. The next really big challenge is one that's more pharmacy centric, and that's the hepatitis C treatment access issues. The work that I've been doing over the last 3 years is in tracking prior authorization criteria for hepatitis C treatment and Medicaid programs. And the reason we track it is because we've come to learn that when hepatitis C treatment came to market in 2013, it was the first curative therapy that we had for hep C. Prior to that, we had terrible treatments, right? People would be on peg interferon for many months of their lives, and it was essentially like feeling like you had the flu all the time for months on end. And you typically weren't cured from it. And so when these new direct-acting antivirals came to market starting in 2013, they came to market at a really high price tag. I'm talking $1,000 per pill, and a normal treatment course was about 12 weeks, right? So we're talking almost $100,000 to cure someone of hepatitis C. Fortunately, the price has come down significantly since 2013, but they're still pretty expensive. And so as a result of the cost, insurance companies put in place prior authorization criteria to limit the number of people who could access treatment. Because realistically, they were like, we've got a finite budget. We can't treat all of the people living with hepatitis C with limited resources. But what we found is that the criteria that are used for hep C treatment is pretty discriminatory in comparison to the criteria that we apply to other disease states. And so, for example, it was very common for insurance companies to say, you have to have a severe liver damage in order for us to cover your treatment. Or it was common for them to say, you have to abstain from drugs and alcohol for 6 months before we'll treat your hepatitis C. And so if you think about this in the context of other diseases, right, that's like saying, we won't treat your lung cancer until you stop smoking for 6 months. Or, you know, we won't treat your cancer until it's stage 4, right? We would never do that for any other condition. And so it was really discriminatory for it to be applied in this manner for hepatitis C. And so our organization has been partnering with a group at Harvard Law School to track these criteria for the last 5 years. And really, it turned out to be a very impactful and important advocacy tool. We essentially grade states on what their treatment access is for hepatitis C. And over time, we've seen these Medicaid programs change their policies as a result of our advocacy. Certainly when advocacy doesn't work, we turn to things like litigation. We will sue the state, which has also been a really effective tool. But we try to start with lower barrier efforts like advocacy. And so, you know, we have these report cards that say, here's how your state is measuring up to other states as it relates to this issue. And then we work with patients and clinicians to actually show up at Medicaid programs. The committees that make these decisions are pharmacy and therapeutics committees, drug utilization review boards. All of the meetings are public. And so we have people show up at the meetings to provide testimony about how these barriers are impacting their patients. So these treatment access challenges are certainly a huge policy issue that fortunately we've made some good progress on. In fact, as of just a month ago, 22 states have removed prior authorization for hep C treatment.
And that includes Rhode Island, I believe, with your
that includes Rhode Island.
And
yes.
our mutual friend Lynn Taylor, who talked about hepatitis last year on the pod. So we were grateful for her.
Lynn Taylor is fantastic. She's a physician and really a strong pharmacy champion who has long worked on this issue in Rhode Island. And so a few years ago, Rhode Island Medicaid made the decision to remove prior authorization. And ultimately, you know, removing prior authorization isn't like the magic bullet to treating everyone living with hepatitis C, right? It's not going to automatically increase the number of people who are seeking treatment. You got to invest in things like outreach and testing, but it does significantly streamline the process for people who are already engaged in care. You know, when we think about the populations that are disproportionately impacted by hep C, there are two kind of primary groups, right? It's the baby boomers who were born between 1945 and 1965. That group of folks likely got hepatitis C inadvertently through things like blood transfusions that were unknowingly infected with hepatitis C before we started screening blood transfusions for infectious diseases. This happened, you know, in the 1990s, and so people would go into the hospital for totally normal procedure, a hip replacement, and they'd get some blood at some point, and they didn't know that it was infected with hepatitis C. And, you know, 10 years later, they find out that they've got cirrhosis and the source is hepatitis C, right? So that's the first primary group. The second primary group is people who use drugs. And so, Brindley, you laid out very nicely at the beginning that the majority of new infections today are among people who use drugs, and more specifically, people who inject drugs. And so in thinking about the opportunity to lose people to follow up as we're trying to move people through our very complicated healthcare system, prior authorization process is a very complicated one and a difficult process to navigate for someone who has difficulty accessing and navigating our healthcare system. So prior authorization is not the magic bullet, but it definitely simplifies care for people who are already engaged.
I couldn't agree more. I think you perfectly explained the importance of advocacy and taking all of these steps that we possibly can. But then I think there's also definitely another matching part of it, which is what can we do for these communities to make treatment more equitable, more accessible, and remove these discriminatory barriers. And so on this topic, I think it's a perfect transition into harm reduction and all of the different strategies that we can use in that realm to really help towards the goal of eliminating viral hepatitis. And so I would love to learn a little bit more about the policies and strategies that your organization does specifically related to harm reduction for this goal.
Yeah, absolutely. Harm reduction is such an important public health topic right now for a variety of reasons. I mean, we are in the throes of an overdose crisis, but beyond the kind of obvious impacts that the overdose crisis may have on people, there are impacts that people may not think about, right? Which are infectious disease consequences. And so that's where my organization comes in and really tries to advocate for the full range of policy issues that might impact a person living with viral hepatitis. And so in thinking about, the community that is most impacted by hepatitis C infections today, it's people who use drugs and people who have a substance use disorder. And so harm reduction has to be a critical component of our advocacy work. It is one of the cornerstones of preventing new viral hepatitis infections, in addition to things like hepatitis A and hepatitis B vaccines. But harm reduction is, understandably a controversial topic for many people, right? It is something that is new to most folks. It is something that most people just don't have a lot of day-to-day exposure to, right? And it has been politicized in the last couple of years. And so while to anyone that works in public health, it seems like an obvious answer to some of our public health crises, whether that's substance use disorder or infectious diseases like hepatitis C and HIV. But to your average person, it takes a lot of education to understand how this has a role in addressing these public health issues. And so for us, there are a couple of primary policy issues related to harm reduction that we engage in from time to time. The first is still funding, right? So just like we're advocating for funding for viral hepatitis programs, there's also dedicated funding for harm reduction programs. So funding is always a priority for us. But more tangible policy issues include things like the legality of syringe service programs, right? So ultimately, the way that we prevent hepatitis C and HIV infections is to provide people who use drugs with sterile equipment for drug use, right? And so programs like syringe service programs that not only provide sterile equipment, but also other services like naloxone, and sometimes even will link people to care for those that are interested in starting medication for opioid use disorder. It is a very easy and low barrier prevention tool, but these programs aren't legal everywhere. And so laws vary state to state. In places where they are legal, they have different requirements. Sometimes the requirement might be that in order to receive 10 clean syringes, you have to bring in 10 used syringes, right? It has to be an even exchange. You can't just walk into a syringe service program and ask for, say, 30 syringes without having 30 to exchange them for. In other states, it might be that syringe service programs are actually being run by the state and not by community organizations. And so, stigma is a huge issue in our community, both people living with hepatitis C and people who have substance use disorder. And so in thinking about, the average person not being educated about harm reduction and why it's important, most people, and the fact that many of these communities have had really stigmatizing encounters with our healthcare system, restricting access to things like syringes and other supplies, only making those available in places like a health department or a place that's run by the government is not going to increase access, right? It's going to severely limit the number of people who are able to receive those services. And so that's another way that we've seen access to these services be limited, is requiring that they be received in government institutions. So SSP legality is definitely top of mind for us. Similarly, there are other, drug paraphernalia, in air quotes, that often get criminalized. So things like fentanyl test strips, which in my opinion are, both syringes and fentanyl test strips are very easy opportunities for pharmacists to play a role in addressing the substance use crisis, right? I should be able to walk into any pharmacy and purchase syringes and fentanyl test strips. But even things like fentanyl test strips are criminalized in some states. And so criminalization is a huge issue and priority for us. Both, the legality of syringe service programs in general, but also criminalizing the person for possessing supplies like this. I'll also just note that, in some states, they actually criminalize you for having the infectious disease. So thinking about someone who may get arrested, if you're living with hepatitis C, could be charges brought against you if you, say, spit on a police officer. You could be charged with a felony for being someone that is living with hepatitis C and you spat on someone in law enforcement. And so not only are the supplies for drug use criminalized, but the actual disease themselves can also be criminalized in some states. So criminalization and syringe service programs and funding for them are super, super top of mind for us.
Thank you so much for that. And I'm so glad you touched upon the accessibility of these different interventions as well, and really clarifying that although it's different in every state, but even though you might have an avenue to go get, let's say, clean syringes, for example, it's not always an easy thing to get, because you are still dealing with things like stigma and some other really difficult paths to cross through that's making it difficult for people to take advantage of these resources that are trying to be distributed among the population.
Absolutely.
And I'm so glad you brought up decriminalization as well, because I think that is also such another important topic to talk about that goes hand in hand with harm reduction. And so to give our listeners a little bit of a background, I would love to briefly talk about the World Hepatitis Alliance and this declaration that they published, which I think has a phenomenal title called No Elimination Without Decriminalization. And essentially, this declaration identifies harm reduction as really one of the core interventions that is needed to eliminate viral hepatitis. Some of the other core intervention areas being hepatitis V vaccination, prevention of hepatitis from mother-child, injection blood safety, and then, of course, testing and treatment. And what's really cool is part of this document makes a really interesting call to action to remove barriers that prevent people from accessing a full range of harm reduction and hepatitis prevention services like we really just talked about. But particularly, it discusses the reform of laws related to criminalization of minor non-violent drug offenses. And so I would love to get your thoughts on the role of drug decriminalization and how it could impact really the goal of hepatitis elimination.
Yeah, absolutely. I was super excited to present on this topic with Jeff at our at the American Pharmacists Association annual meeting just a couple of months ago. And we did a lot of work in ultimately getting a policy passed that supports decriminalization. And, it was not an easy feat, right? It took a lot of education. And it's clear to me that this will continue to be a topic of importance to the addressing the overdose crisis. I work in a community in which I'm regularly engaging with harm reductionists and with drug policy experts who have a lot of data and just enthusiasm around this topic. And I forget sometimes that this is not the view that the majority of the world and country shares, right? So it's always nice to kind of step out of that bubble and interact with people that are not as plugged into these issues and have really real conversations about, what this is and what it isn't, and ultimately why it's an important tool in addressing the overdose crisis. And so for me, it's important to start with the definitions, right? We've got to make sure that people understand what decriminalization actually means. And so decriminalization is the removal of criminal penalties for simply possessing or simply using drugs, right? It doesn't have anything to do with legalizing drugs. That's a totally different pathway that actually establishes a regulated market for the sale of illicit substances. Decriminalization is just saying, we will not arrest you for possessing or using drugs. Arrest and subsequently convictions can ultimately lead to having things like felonies and misdemeanors on your record for a long time. And those things ultimately impact people's lives in a variety of ways, right? People getting a simple arrest can lead to people losing their housing, right? It can make them ineligible for housing benefits. It can affect their employment. It certainly affects their families, right? There are so many long-lasting consequences of arresting and convicting people who for using or possessing drugs. And so decriminalization is really just saying, okay, we won't arrest people for this. We would then be viewing things like simple possession or simple use, similar to the way that we view jaywalking, right? Of this is something that we would prefer that people don't do, but we know that people are going to do it anyway. And therefore, we're not going to arrest you or fine you for doing it. So the decriminalization topic has come up in the last few years as Oregon was the first state to actually pass a ballot measure supporting decriminalization. And so this was implemented within the last couple of years. We are still analyzing the data around what the outcomes are, but what we think the outcomes will be are that it's obviously going to decrease the number of people who are arrested and subsequently convicted of charges about simple possession and use of drugs. We also think that it will help decrease overdose deaths. There's some data in other countries that have done this, like Portugal, that show that decriminalization has public health benefits. Not only does it reduce the number of people who are arrested, which ultimately arrest leads to other consequences, right? Like people who are arrested and ultimately incarcerated don't have good access to things like medication for opioid use disorder, right? Even people who are arrested and may not be incarcerated, but may end up on like parole or probation. Again, a lot of those programs require, they mandate abstinence, which again is not always the answer for everyone who is suffering from a substance use disorder. And so ultimately, data from other countries is showing that not only does this decrease arrests and all of the challenges that come with an arrest record, but it's actually has health benefits, right? It's decreasing overdose deaths. It's reducing the number of infectious disease consequences that we're seeing from drug use because it reduces stigma in many ways. And so people are more likely to access services like syringe service programs and other harm reduction efforts that ultimately keep them safe while using drugs. And so for me, decriminalization is something that we're still as a country probably a long way away from supporting. We, in fact, we've probably seen in the news just in the last couple of weeks that the federal government classified xylazine as an emerging threat. We're seeing xylazine as an animal tranquilizer that we're seeing often contaminate substances like fentanyl. And it's Philadelphia, I believe, or Pennsylvania just as a state just moved to classify xylazine as a controlled substance, which again ultimately leads to criminalizing more people that are found to be using the substance. And so there's a lot of discussion around this at the national and state level. So I do think that we're a long ways away from fully supporting decrim as a country, but I was super excited to see that the American Pharmacists Association ultimately passed policy supporting this concept, right? There are other organizations like the American Public Health Association, the association, and I'm going to get this acronym wrong, ASAM. Jeff, help me out. The
American Society of Addiction Medicine.
Thank you. Yes, who also have policy supporting decriminalization. So we're not the first professional society to support this, but I think we're an important one to support this because pharmacists have the opportunity to play an important role in this, and we certainly have to do our part to help decrease the amount of stigma that people face, people living with substance use disorder face, and to really treat substance use disorder for what it is, which is a public health issue and not a crime.
It's interesting, timeliness is everything. So I was at, one of the things that my role and on this rotation too is advocacy, and we're testifying. And so I was at a state senator's fundraiser. I ran into an advocate who's been trying to get a defelonization bill passed in Rhode Island. And we've done lots of things here, Haley McKee. And I think she'd be fine with me discussing her history. She's public about it. She works with our health department where I have my practice site. And, she's like, I need you to testify. They will listen to you. Pharmacy has a role. I missed the House hearing, the Senate hearings came up. Here's a person sort of the opposite of what you said, like we're in our little decrim bubble and you step outside. But even in that bubble, here's a person in long-term recovery, an opioid overdose survivor, and someone who is formerly incarcerated, who has all of the lived experience, but also has the savvy and communication skills to say, look, got to talk to senators, you got to do that. And so I'm just going to come back to our first point is like, you got to show up at these things.
Absolutely.
And like the half hour I spent talking to her, not only uplifted me and uplifted her, we have to support each other, but it also gets me out of this sort of like at the core of that bubble to be like, these are the people we're really fighting for. And it's one of those things where it's the 5th year she's trying to get it passed and knows that, gosh, if a pharmacist comes to that hearing or writes a paragraph to say, I love selling over-the-counter syringes, I feel like I'm helping people. That's what I'm telling my students to do. So I think that's the important thing.
Absolutely. You got to keep showing up. Oftentimes advocacy is a long game. So even though, I mentioned, I think we're a long way away from as a country supporting decriminalization, but, without people pushing for this issue each and every day, we'll never get to the place at which it's a real possibility. And so, for me, in thinking about the communities that are disproportionately impacted by the criminalization of people who use drugs, like it's Black and brown communities who have been incarcerated unfairly. There are still a significant number of people incarcerated for possessing and using marijuana, despite us having a number of states who have legalized marijuana, right? So we have to believe in a society of tomorrow, right? It can't just be living here in the present. And so for me, who knows what will happen 10 years from now? I don't think anyone ever imagined that marijuana would be legal, 20 years ago, that we would be in a place today where it's legal in many states. And so I take the same approach in thinking about how we should approach decriminalization, that ultimately people need support, they need love, and our job as healthcare professionals is to keep them safe, and most importantly, to keep them alive. And so I will do whatever I can to fulfill that promise and responsibility as a healthcare professional. And I think decriminalization is a component of that.
I couldn't agree more about where this conversation has been going. I think between what you said about showing up and making sure your voices are heard, especially in these efforts, and then also Dr. Bratberg, what you said about really the value that pharmacists can bring to advocacy is so important. And so on that note as well, kind of between the advocacy efforts and the scope of what pharmacists really can do now, Dr. Simmons, you are a pharmacist by training, and you also have a background in educating others on the role of pharmacists in viral hepatitis elimination. And so to kind of sum up our conversation, what are some unique ways that you think pharmacists are able to become more involved in these efforts to eliminate viral hepatitis?
Yeah, well, certainly we can continue our roles as key immunizers, right? Hepatitis A and hepatitis B, these are easy, low-hanging fruit in terms of opportunities for pharmacists to make an impact. And so I would encourage folks that are working in community settings to be sure that you're up to date on the guidelines. We now recommend Hep A and B vaccinations for everyone under the age of 70. And so be offering that service in your pharmacy. Or the other services include things like syringes and maybe even fentanyl test strips, right? There are some programs in various places across the country that are offering that within a pharmacy setting. Super, super important. Naloxone and medication for opioid use disorder, ensuring that you're supporting access to those harm reduction tools, also very important. I will say that on the viral hepatitis topic more specifically, there are some pharmacists across the country doing really important and innovative work in this space. My organization has been partnering with an independent pharmacy in Seattle for the last couple of years called Kelly Ross. And one day a week, they come on site to our syringe service program and test people for hepatitis C infection. And those who screen positive are then offered treatment. And these pharmacists are prescribing treatment through a collaborative practice agreement with a physician. So there's no physician on site, but they have this agreement in place. They're able to test people. They're even the pharmacists are even drawing the blood, right? Like they are doing the entire suite of services from phlebotomy to prescribing treatment and helping patients navigate the actual treatment process. So there are opportunities. Those same pharmacists, they come to our program one day a week. They're also going to public housing communities, right? And other social service organizations that may have a significant number of people who are living with hepatitis C. So meeting people where they're at is a phrase that you'll hear a lot in the harm reduction community. And that is certainly very true of meeting people living with viral hepatitis where they're at as well. And then, I would say for the folks that are in decision-making and policy-making roles, whether that's within a Medicaid program or maybe you're a leader within a hospital that has some responsibility over which medications are offered in your hospital or clinic, reviewing those criteria and making sure that they are conducive to allowing access to treatment to as many people as possible is a way that you can impact multiple patients living with hepatitis C. So for me, maybe we'll close with a note about awareness, right? Of like, it's Hepatitis Awareness Month, and the reality is that many people are not aware of their status. And so we have a role both as pharmacists, but also just as community members in helping educate people that they should get tested for hepatitis B and hepatitis C, and that there's a cure for hep C. Many people don't know that either. So I'm certainly going to be doing my part to reach out to friends and family and say, hey, did you know that every adult should be tested for hepatitis B and hepatitis C at least once in your lifetime? And that's not only a way to decrease stigma, but it's a way to make sure that we identify all of the missing cases out there. So I'll leave you with that. If you haven't been tested for hepatitis B or hepatitis C, go get tested and tell a friend to do so too.
That's awesome. I don't know if we can summarize this, but we always ask what the regimen is for the elimination of viral hepatitis. Brindley, you got a summary for us?
Absolutely. I think probably the biggest overarching theme for the regimen for elimination of viral hepatitis is to take advantage of all of the different hats that pharmacists can wear. Putting on your advocacy hat and advocating for better policies for harm reduction and for decriminalization of drugs, putting on your community pharmacist hat and getting out into the community and helping in testing and treatment efforts. And if you are in that role of being a policymaker or a decision maker at your organization, making sure that your voice is impacting the policies that your organization and where you're aligning in this fight against viral hepatitis. So in summary, put on all those different hats, make sure your voice is heard, and do your part, especially in the month of May for Viral Hepatitis Awareness Month. But really, this has been such a great discussion today and so timely for our Awareness Month. And Dr. Simmons, I cannot thank you enough for dedicating a little bit of time today to come chat with us. This was a great discussion, and I'm sure our listeners are going to appreciate all of the insight that you provided today.
Thank you so much for having me. It's been a pleasure.
Yeah, be sure to follow us, and I'm sure there's lots of socials that we'll tag, but we'll start it out at PharmD Pub Health on Instagram and Twitter, and turn on post notifications so you never miss an episode. Smash that subscribe button now on Spotify, Apple Podcasts, YouTube, Amazon Music, or wherever you listen to podcasts. get connected with the regimen at PharmD Pub Health, and happy testing and awareness spreading.